Hi guys, I am back and it is no longer the crack of dawn, so I can hopefully think clearly and not pretend it's Saturday when it's actually Friday. That was quite amusing, but I felt like such a jerk. Anyways, um, I did some fun videos and they were great, but I did also tell you guys when I came back that I wanted to talk about some serious stuff too, and I absolutely do. And I was thinking today about what I want to do a video on. One second, I need coffee still. So there's one thing that I really wanted to do last time when I was on YouTube, and I never got to it. And so I'm going to start off with this one. And this one is about a very, probably not the most exciting, popular topic, but a super important one. And it's about heart attacks and heart attacks, and we call them myocardial infarction, right? But what the problem I have is that everybody, I see it, you see it all over and you hear about it. When I worked at Emerge, people would come in and they'd say, oh, I think I have the flu, I've got this back pain and this pain in my neck and burning in my throat and nausea. Usually it would be women, or yeah, my arm is sore, or yeah, the pain in my back is in my arm too, or in the back of my arm or my shoulder, but it's just in my shoulder, or that sort of thing. People think of heart attacks and they think of like grasping your chest and hitting the floor and like you're dying and that's it. And 9 times out of 10, that's not what you're going to see. So that does happen. Of course, it happens. People do like have heart attacks right out of the blue and they hit the floor and they're dead when they hit the ground. But that isn't typically what's going on. So a lot of times people will have multiple small heart attacks along the way before they have the big one, before they have that hit the ground heart attack. And what they'll experience is any symptoms in your upper body, I would say, and I'm not a doctor, again, I'm a nurse, I'm just giving you from my experience and what I've learned. Any experience from above your navel, your belly button, that you're feeling any pain or discomfort that is ongoing, not something that's coming and going, but a pain that is ongoing, a discomfort or a cramping or a squeezing or anything that it's a discomfort. It doesn't have to be pain. Above the navel, all the way up to the neck, to the jawline, to right above the jaw. Anything like that going on in conjunction with a second symptom above the navel, usually a shortness of breath. It would be usually a sick stomach and I can't catch my breath. Or anytime you see somebody that's having any of these symptoms and sweating on their face, that's a very concerning symptom. That's something to be taken seriously. That's a trip to the Emerge. Anything in conjunction with shortness of breath is a reason to go to the emergency. It's not overreacting. I know people are afraid of overreacting and going to Emerge for reasons they shouldn't. There are a lot of reasons not to go to Emerge, to go to a walk-in clinic or your family doctor. There's things that can wait. But the things I'm talking about, those things can't wait ever. You have any of those symptoms, any of that nausea, cramping, discomfort, a lot of people will describe it as an uncomfortable feeling. They can't really describe it. They just don't feel right. They just feel discomfort, and they have shortness of breath too. And sometimes they'll have some sweating on their face, or oftentimes you will have like radiating pain down one arm or the other arm. It could be either one, but it doesn't have to be that. Like, it absolutely doesn't have to be that. And there'll be people that have multiple little heart attacks and they never know. It just causes heart damage. And every time there's a little bit more damage to the heart, a little bit more damage to the heart, until they have that big, huge heart attack that is really hard to recover from, and that is you're less likely to recover from. So I just wanted to get on and have a quick chat about that. The other thing, I'm going to do a video about CPR. It won't by any means replace a CPR class. Everyone should take CPR, because I have seen so many occasions where someone is in trouble, they're on the ground, they're not breathing, and everybody's standing around watching. And there's people in that group that know CPR. They just might not know exactly how many breaths or how many compressions. They don't know exactly the numbers or the combinations. I mean, not even breaths anymore. But people are nervous to step up and do it. But I just want to leave you with one thought before I go, that you can't get more dead So there's no such thing as bad CPR. In a hospital, in an emergency department, with trained professionals that know how to do CPR, yeah, there's bad CPR. There's people who suck at it and they shouldn't be doing it, or someone else should be doing it for them. But out in the community, if you do, if they're gonna do anything and you can't find a pulse on someone, just start doing chest compressions. You can't go wrong. You don't have to breathe. You don't have to count. Just start going, and as fast as you're doing them, do them a little bit faster, because yeah, it's very quick. It's not like on TV where it's like a push, a push, a push. That's not CPR. CPR is fast. It's a fast paced. It takes a few minutes. It takes quite a few minutes to get that blood to circulate around the body with oxygen in it, even once after CPR is started. So this is a fast moving thing. This isn't like a quick slow motion kind of action. So you can't go wrong. There's no bad CPR when you're in the community. If nobody's doing anything, you get down there, you get on your knees and you do it. And the indicator that you're doing it right is that it's going to be hard as hell. You're going to be sweating. You're going to be out of breath, and it's hard. It's a 2-person job to do it properly. But you do the very best you can. You work with what you've got and you do your best. And, you know, getting in there and just doing those compressions, no matter how you do them, can make the difference. Time is heart tissue, and it's that oxygen getting to the heart that makes the difference in a person's recovery. It could be the difference between their life or death, but it can also be the difference between how they recover. And a recovery could be the difference between whether they ever get to climb a flight of stairs again because their heart can handle it, or push their granddaughter on a swing, or walk to the park with their dog. Like, these are things that when you have serious heart damage, you're not able to do anymore. You lose a lot of quality of life. But doing CPR nice and early really reduces the possibility of that, and really improves people's chances of having a much better recovery. If EMS is able to get there quickly enough to be able to take over and to get them to the hospital so they can get the care that they need. So I'm going to leave you with that. I know it was kind of a lot of information really quickly, and it was kind of serious stuff, but it is serious stuff, and it's common, and it happens more often than you realize. And don't forget it. If you're out in the community and you see someone on the ground, go over and check them out. They might not be sleeping. Like, give them a little nudge with your foot, see if they wake up. And again, like, any symptoms above the waist, more than one symptom at a time, get into that emergency department. There's no harm. Even if you call an ambulance, they don't always take you to the hospital. They'll throw the monitor on you, and they'll check your heart. And if they think your heart is fine, often they'll say you can stay home. But if this happens, go to the hospital. And then other times they'll say, no, I can see right on the monitor that they are in fact having a cardiac arrest, and they will get you to the hospital and get you meds and get you everything you need quickly. So they don't always take you just because you call them. It's always worth the call to EMS if you're not sure. Just dial 911. They'll come, they'll check you out. If you don't need to go, you'll stay home. If you do need to go, you got a ride, and you're going to get there, and you're going to get the care you need in the time you need it. So that is all. And the next video I do will be something a little more fun, hopefully, unless I think of something horrible and something I just got to get it on my system. All right, so have a lovely rest of the Friday. I mean, there's not much of it left, but have a good evening and have a great weekend, guys. And I'll definitely be on here at some point. You'll see me. And thank you so much for watching the videos. I really appreciate it. Thanks a lot.